initiative as people continue to reach out to help those, including our children, who are in need at this time. Dr. Kia Lewis, a coalition member, is joining us now. Good morning to you.
Hi, good morning, Cassandra. Good morning, Shane.
Good morning.
Yeah, we are certainly happy that you decided to join us to share. So it hasn't been officially launched yet, so we feel really special that you're sharing the message with us here on Mornin Barbados. What can you tell us about this Healthy Hamper initiative that the Heart&Stroke Foundation of Barbados is undertaking in the face of COVID-19 to help our children fight childhood obesity?
Okay, it's just to clarify a couple of things. So it's actually the Barbados Childhood Obesity Prevention Coalition, of which Heart&Stroke Foundation Barbados is a member. It's a coalition with 18 civil societies and about 40 individual members that was started last year and is growing rapidly. So that is actually the organization that is dealing with the Healthy Hampers initiative. And what we're looking to do is actually target, so we're looking to actually target persons with NCDs, non-communicable diseases, like diabetes and hypertension, who might be having a very difficult time financially and other ways. And we're looking to provide them with produce boxes. So boxes containing vegetables and fruits and any produce that we would get. The heart of this initiative, it came up, we were really watching as a coalition, and we were so heartened and encouraged by the efforts of others to give back to Barbados, to support those who are vulnerable and going through a difficult time by giving food hampers. You know, we were really encouraged by that. But of course, many of us are healthcare professionals, and we were concerned about the lack of vegetables and fruits in some of these baskets, which we understand might be due to logistics, etc. And of course, some of the foods that are included might not be the best for our hypertensive and diabetic population. And so we wanted to basically help those who, like I said, are going through a difficult time, who have these chronic conditions, and would love to be able to augment their nutrition with fresh fruits and fresh vegetables, because we know it's so important for their immunity at this time.
Dr. Lewis, there's a large part of our population with these chronic illnesses that lead to things like obesity and other issues. How many people are the coalition targeting right now in this first phase of rolling out this program?
Well, Shane, I'm glad that you pointed out as a large population, because in fact, 1 in 3 persons in Barbados right now is hypertensive. When you look at between the ages of 20 and 65, 1 in 5 persons is diabetic. And over the age of 65, it gets even worse. 1 in 2 persons over the age of 65 in Barbados is diabetic. And that is something that's very serious as we think about COVID-19, about this pandemic, and how it's targeting those who are not only older, but have these chronic conditions. And those persons are the ones who tend to develop more severe disease and can go on to, unfortunately, pass away from this condition. So it's a really, really serious thing when we look at it holistically. But we are working through the Prime Minister's Office, the mitigation unit. We've partnered with Tory Lane to identify these families. Fortunately, they've been able to capture these families and to capture the ones specifically who have NCDs so that we can lend assistance.
Excellent. So let's talk about the launch and what you expect from other people who are already out there reaching out with all good intentions, but how can they connect with you and be stronger together?
Yeah, so like I said, we have a number of objectives in this. Of course, it is to support persons in a tangible way. Secondly, is to spread the message to Barbados, Barbadians across the country, the importance of augmenting their nutrition, of using healthy things, your vegetables, your fruits. And then it's to encourage those who may be doing their hampers, and so if at all possible, wherever possible, to include fruits and vegetables in those hampers. I know that this is a difficult time, availability may be challenging, but like I said, wherever possible, it would be wonderful, and it's necessary, so necessary for the health of our nation at this time, that we think about health and that we include those fruits and vegetables in those hampers. So it's really to lead by example, kind of put our money where our mouth is, to offer support to other organizations as well.
So, Dr. Lewis, how is the coalition doing it in terms of are y'all doing deliveries, or do people need to come to collect these hampers. And the other thing is, you can take the camel, the horse, or whatever animal you want to use in the analogy to the water, but you can't make them drink. How are you going to help people to understand, using these vegetables and how important it is to use the produce to improve their standard of living and their lifestyle, basically?
Well, to answer your first question, like I said, we would identify those families, and therefore we are going to be working with the Prime Minister's Office in Mitigation Unit to deliver hampers to those families specifically. Additionally, in terms of, so they won't have to come to us, we will deliver, we will package the hampers and deliver. In terms of getting the information out there, we have been doing a lot of work on the ground, in our individual spaces and as a collective to get the message through social media out there. For example, Heart&Stroke Foundation Barbados had a series, Healthy and Lean in Quarantine. Diabetes Foundation, I know they're doing their own series, and there's a lot of useful information out there. So we are actively trying to encourage Barbadians to live a healthier lifestyle and giving them practical tips. So persons can go to any of those pages to view the information and get the information that they need at this time.
Are you also pushing the concern or the constant concern that has been raising its head in every effort to encourage people to eat more healthily, the cost of fruits and vegetables? Is that something you're also trying to address in your effort?
I think as a coalition that this is something that would have been spoken to at the level of government. These are issues that are ongoing, that we are constantly trying to tackle because we understand the complexities surrounding living a healthy life. So we really do need to encourage a healthy environment. A big part of that is reducing access to the unhealthy things, but it's also, like you said, increasing access to the things that people need. And so perhaps creating a basket of goods, a protected basket of goods at a good price that persons can afford is something that we really, really need to look at in the future, making sure that we have that available for persons. Because people are only going to do what they can afford. That's the reality.
Yeah.
Yes, they are.
True.
They are.
The fruits and they taste good. And so maybe too, we also need to show people, Shane, how you can cook them differently, enjoy them differently. We need to do that more because we're already trying to do that.
Yeah, and I'm very excited because we know that there are members of the coalition that have those plans going right now.
Yeah, a lot of these fruits and veggies you can eat raw too, so it's not like it's
you can
big preparation and they're
tasty.
You can
snack on them, you can create meat with them. Yeah. So they're readily. I mean, there's so much things that you can do, so many recipes, so many things to look up. But I think what we're tackling is a cultural thing. Barbadians love these sweet things.
Oh, yeah.
We love these salty things. We are addicted to food that's easily available. We can just go and buy and pick up and move. And so it's not just to change behaviors, but it has to start with a change of mindsets and people to see the importance of maintaining a healthy lifestyle. And COVID-19, I think, has highlighted for us more than ever before that if we don't tackle these things, that we make our population more vulnerable to sickness and to death. We knew this because 8 out of 10 people in Barbados die from non-communicable diseases every year. But I think it's becoming even more apparent with this COVID-19 pandemic, the danger that we face if we don't make some changes and make them quickly.
Yeah, I had a message from a family member of mine. I said to them, if you like all these snacks and these sweet things and this bad eating, you don't like life. So it's a choice you have to make. It's either you like the tongue or you like life. And I mean, we can find creative ways to make some of these meals tasty. So it's so good that the coalition is stepping up in this way to really, really help our population understand the things that they need to do. So that especially those ones, as you said, you get over 60 and you find 1 in 2 people with diabetes. I think many of them have grandchildren that they still want to see in the years ahead. So continue to do the good work.
All the time. Yeah, we all, even as we get older, we all still have goals and dreams and objectives, things that we want to accomplish. But the only way we're going to be able to do that is if we are living a healthy life. So that's the only way to extend life. And it's not just about extending life, but it's the quality of life. When you think about the number of people who are on dialysis or who have amputations or who suffered a heart attack or a stroke as a result of these conditions and the lifestyle associated with it, you really do have to take a step back and say, what can we do to prevent this from going on? And even as we look at our children with childhood obesity and the risk of them then developing these NCDs, diabetes, hypertension at a younger age, it is something that as a government, we really, as a people, we really have to look at closely and see what we can do to mitigate this disaster, because it's really a big problem in our nation.
Sandra, you saw that comment there?
Which comment?
Sorry?
No, I didn't. I looked at my monitor. I just wanted to say thanks to Dr. Brown. Go ahead.
Yeah, we just had a comment there from Patrick Botswick on Facebook. He was just asking for some clarification on the statistics re persons with diabetes in Barbados, because he heard 1 in 2 people, but I guess he didn't hear the age group. So that is over 65,
yeah.
right?
Yes, over 65. Below the age, and this is type 2 diabetes, yes? Below the age of 65, it's more than 1 in 5.
Okay. Again, as Cassandra said there, thank you so much, Doc, for coming and spending some time with us this morning. All the best to the coalition as it forges ahead with what is a great initiative to help improve the health of people in Barbados. Thanks again for coming on the show.
You're welcome. Thanks for having me.
A pleasure.